Hi, I'm Dr. Vikram. I've come to examine you. May I know your name and age, please?
My name is Sai Kiran. I am 24 years old.
Thank you. Now I'm going to perform some examination. Is that fine with you?
Sige.
Alright. Start with the motor examination for your right upper extremity. Alright. So first let's do the flexion test for your bicep and the brachioradialis. Can you give your arm, please? Alright. So first I'll try to pull your arm. Can you try to resist your arm, please? Alright. Thank you. Now let's move on to extension of your tricep. Now I'll try to push your arm. Can you oppose your arm, please? Alright. Thank you. Now let's test the extension at the wrist. Can you place your wrist this way? Alright. Can you oppose my movement, please? Thank you. Again, can you oppose my movement, please? Thank you. Let's test for the grip. Can you hold my fingers tightly and don't let it go? Alright, thank you. Can you spread your hand like this? Okay. Can you please oppose my movement? Alright, thank you. Let's test the opposition of the thumb. Can you place your hand like this? Alright. When I give a pressure, can you oppose your thumb, please? Thank you. Hello. For visual acuity, this is the Snellen's chart. The numerator is nothing but the distance between the patient and the chart, and the denominator is nothing but the normal distance what a normal eye can view this particular object. Let's start the visual acuity test. Now I'll be placing the patient 20 feet apart from the chart. May I know if this is reading glasses?
Reading glasses.
Thank you. Can you place this card on your left eye and can you cover it completely, please? Alright. Can you please read the last line possible?
D-E-F-E-O-T-E-C.
Alright, thank you. Can you repeat the same test by covering your right eye, please? Completely. Can you read the last line possible?
D-E-F-E-O-T-E-C.
Alright, let's check for your visual field. Can you please have a seat? Alright. So please look into my eyes. Don't move your head and also your eyeballs. Please just look into my eyes. And just let me know when you can see my wiggling fingers. Alright? Let's start. Alright. Again. Thank you. Again. Alright. Thank you. Alright. Let's test for pupillary reflex. Will it be fine if I place this light on your eyes? Alright. Now let's dim the light and then let me check the size, shape and symmetry of your eyes. Let's check the direct reaction. Can you focus on my shoulder, please? Alright. First, let's check for the direct reaction. Okay. Thank you. Now let's check for the consensual reaction. Alright. Thank you. Next, let's do the test for convergence. Can you please look at the tip of the pen while I move it towards you? Alright, thank you. Now we will be doing the test for extraocular muscle movement. Can you please have a look at the tip of my pen and please don't move your head. Okay, let's start. Thank you. Next test is for the auditory acuity. Now I'll be doing the Weber's test. This is for lateralization. I'll lightly vibrate the tuning fork and place it on top of the head. Can you hear the sound equally on both the ears?
Yeah, equally.
Alright, thank you. Performing the Renes test on you. I'll be placing a lightly vibrating tuning fork on the mastoid bone. Please let me know when you stop hearing the sound. Alright? Now we will be doing the examen for thyroid gland. Can you please place your head upwards? Alright. So this is the thyroid cartilage, this is the cricoid cartilage and this is the thyroid gland. While the patient swallows, let's check for the upward movement of the thyroid gland along with counter and symmetry. Can you please swallow your saliva for me? Thank you. Now I'll be moving towards the back side of the patient. to palpate the thyroid gland. Can you please place your head upwards? Now I'll be palpating the thyroid gland to check any lumps. Can you please sip some water for me? Alright, the next test is for the chest expansion. Can you please remove the shirt for me? So this is the end of the scapula. So we are at the 7th rib. When we come down on the 10th rib, can you please inhale and exhale deeply for me? We can observe the symmetric chest expansion in our patient. Next test is for tactile fremitus. Now I'll be placing the ulnar surface of my arm on the patient. Can you please tell 99 when I place my hand on the back of your chest? Alright?
99, 99, 99, 99, 99, 99, 99, 99.
Performing percussion. The next test is for the diaphragmatic excursion. Okay. Can you please inhale and hold for me? Thank you. Alright, so this is the line of the diaphragm. Can you please exhale and hold for me, please? Alright, so this is the line of the diaphragmatic excursion. So this is the length, which is usually 3 to 5.5 centimeters, which is normal in our patient. Now we'll be performing the examination for jugular venous pressure. Can you please lay down comfortably? Let's make sure the bed is at 30 degrees. Can you please tilt your head on the left? Okay. Using the tangential light, we'll be inspecting the external jugular vein to check the internal jugular venous pulsations. Okay. So now we will take a rectangular card and we will place on the highest point of pulsation, which is here, and using a ruler we'll place this on the sternal notch, which is the second rib, and using this we will measure the length, wherein we will add 5 centimeters to this. So that is the measurement of the jugular venous pressure. Alright, the next examination is for Rovsin sign. I'll be placing my hand on the left lower quadrant, and while I release my hand, did you feel any pain on the right lower quadrant? Alright, so since there is no pain on the right lower quadrant, so that means that's a negative Rovsin sign, because there was no tenderness while releasing my hand on the right side of the lower quadrant. So the next examination is psoas sign. I'll be placing my hand on the thighs. Can you please resist it and raise your leg upwards? Alright, so do you feel any pain? No. Since there is no pain, our patient has got a negative psoas sign. Alright, so the next examination is to check the operator sign. Here what I'll be doing is I'll be flexing the thigh at the hip, and I'll bend the knee and I'll make an internal rotation. So do you feel any pain here? No. Alright. Since there is no pain, our patient has got a negative operator sign. So the next examination is for Murphy's sign. So I'll be hooking my fingers underneath the costal margin of the rib. Can you please take a deep breath? Do you feel any pain?
No.
No. Alright, since there is no tenderness, so that means our patient has got a negative Murphy's sign. Now I'll be performing drop arm test. Can you please raise your hand 90 degrees? Alright, so since there is no weakness here, the patient is normal. The weakness in this maneuver suggests there is supraspinatus rotator cuff muscle tear. To check for decurvant synovitis, we'll be doing a thumb movement test. Can you please hold in this position? Yes, and bend your hand forward. Alright, can you please check this? When the arm is bending forward, if there is some pain here, this maneuver will suggest the decurvant synovitis, and it is also called the Finkelstein test. Okay. Now let's check for carpal tunnel syndrome. Can you please give me your hand? Okay. Now I'll keep a pressure on the thumb. Can you please raise your thumb against the pressure? Okay. Thank you. So now let's check for anterior cruciate ligament tear. Now the patient will be in the supine position. Can you please flex your thighs at the hips and both the legs together? Okay. Right. Okay, so that's the test. Thank you. Okay, so the next examination is for cranial nerve 5, that is the trigeminal nerve. Here we have motor, sensory and corneal reflex. First let's do the motor sensations, alright? So I'll be placing my hand on the temporal region. Can you please clench your teeth? Okay, so this is the masseter region. I can feel the contraction here. Okay, can you please clench your teeth and move your jaw? Thank you. Alright, so next let's move to the sensory movement, alright? So now I have a sharp object. Now I have a sharp object and a blunt object. Can you please open your eyes? This is the blunt object and this is the sharp object, alright? So can you please close your eyes? When I place it on your face, please let me know whether it is blunt or sharp, alright? Okay.
Blunt. Sharp. Blunt. Blunt. Sharp. Blunt.
Thank you so much. So now let's move to corneal reflex. Okay, so now I'll be using a cotton to place it on the cornea. Can you please open your eyes and look upwards? Thank you. So that's the corneal reflex. Alright. So the next examination is for cranial nerve 7, that is the facial nerve. Alright. So now I'll be inspecting the movements of the face while the patient is normal and while we are having a conversation. Alright. Okay. So can you please raise your eyebrows? Thank you. Can you please ground? Thank you. Can you please close your eyes tightly? Can you please resist my movement when you do that? Thank you. Can you please open your mouth widely? Can you please show your teeth, up and lower teeth? Wider. Alright. Can you please smile? Okay. So can you please puff the cheeks? Thank you. The next examination is cranial nerve 11 and that is the spinal accessory nerve. Okay, so let me go behind the patient and check for any atrophy in the trapezius muscles. Alright, it seems normal. And now I'll be placing my hands on the shoulder. Can you please shrug your shoulders? Alright, here I can feel the strength and the contraction of the trapezius muscles. Okay, now what we will do is we will check for the sternocleidomastoid. Okay, can you please turn your head towards the right side? Okay, I'll be giving a pressure. Can you please resist it towards my hand? Thank you. Can you please turn it on the left side? Can you resist my hand? Okay, I can feel the contraction on both the sides. Thank you. Now let's elicit the following reflexes, starting with brachioradialis reflexes. Now I'll be holding the patient's hand like this, okay? Alright, so when we do this, we will be watching for flexion of the brachioradialis. And now the next one is for the tricep reflexes. So here we'll be placing the hammer. Alright, so that's for tricep reflexes. And now let's move on to the knee reflexes, wherein let's check for any contraction here. Alright. The next one is for the Babinski reflex. It's a negative Babinski sign. Okay, so next we will be doing the test for following sensation. First we will start with light touch. Okay, so this is a cotton wherein I'll be placing it on the body. Please let me know when you feel the sensation, alright? Can you please close your eyes? Alright, so next we will be checking for pain, wherein I have a sharp object and a blunt object. Okay, can you please open your eyes? So this is the sharp object and this is the blunt object. All okay? Can you please close your eyes?
Sharp. Blunt. Sharp. 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 Sharp.
Alright, thank you. So next will be proprioception. I'll be holding the finger your big toe and I'll be pushing it upward and downward. Please let me know whether it is upward or downward. Alright, can you please close your eyes?
Up, down, up, down.
Thank you. Alright, so the next one is for vibration. So this is the tuning fork we have here. Okay, so I'll be placing the vibrant tuning fork on the body. Please let me know when you stop feeling the sensations. Alright, close your eyes please.
Stops. Stops.
Thank you. Okay, now we will be performing a complete cerebral testing. First we will start with rapid alternating movements. Okay, so first we will do the rapid alternating movements of the arm. Can you please do this rapid alternating movement as quickly as you can? Alright, thank you. Now let's do the rapid finger movement. Okay, can you please place your finger hand like this? Can you do this rapid movement as quickly as you can? Now can you tap the ball of each foot on the floor as quickly as you can? Thank you. Now we'll be doing the point to point movements. First we will be doing the finger to nose. Alright, can you please place your finger on the nose and then on my finger please? Yeah, can you repeat it? Now can you please open your eyes and do it? Alright, so now can you please touch this finger again? Okay, can you please close your eyes and touch it again after touching your nose? Yes. Alright, okay, thank you. Now let's do the heel to shin test. Can you please place your foot this way and can you please rub it from heel to shin like this? Alright, thank you. Okay, now let's check the gait of the patient. Can you please do a normal walking from here to there? Alright, can you come back please? Okay, can you now do an rope walking? Can you please do a rope walking, heel to toe? Yes. Can you come back please? Alright, very good. Now can you please walk on your heels? Can you please walk on your heels? Yes, come back please.
Come back.
Come back. Alright, now can you please walk on your toes? Alright, very good. Can you please hop in the same place? Yeah, can you come back please? Okay, can you do a shallow knee bend like this? Can you do a knee bend like this? Shallow knee bend? Yeah, very good. Alright, thank you. Okay, now we have two special tests. The first one is Romberg test, alright? So can you please stand still, feet together, and can you please close your eyes and without any support, can you please stand in the same position for 30 to 60 seconds? Alright, now can you please have a seat? Alright, next we will be doing the test for pronator drift. Can you please stand up and can you please raise your hand forward? Please close your eyes and stand in the same position for 20 to 30 seconds. Please close your eyes without any support. Alright, thank you.